This weekend marks 1 year since the first case of COVID-19 in Minnesota. Tonight I talked with Dr. George Morris with CentraCare about what we've learned in the past year. Do you remember the day when we discovered the first case of COVID-19 in Minnesota? What was your reaction?
I remember even the month or so before when we were preparing for that. Yeah, but that first case of identifying a cruise-related travel, March 6th, that was a big day, because then we knew that it was here and that we had to put in place all those plans that we've been talking about.
When did you realize the gravity of what we were actually up against? Do you remember that moment for you?
Yeah, for me, it was when it came to St. Cloud. You know, my practice is in St. Cloud with CentraCare, and that was another one where this went beyond just a big city kind of issue. And we knew that it would hit small towns, big towns, farmers, you know, any type of worker. And that is kind of when it hit home that this was going to spread everywhere and that nobody would be untouched by COVID.
What was it like for your team? I mean, what has it been like for the people that you work with? We're going on a year.
Fatiguing, tiring. This is draining emotionally and physically. You know, and I think that's the longest part is early on when we looked at this, a lot of the models showed a surge, you know, one big wave, you know, that large peak. And we were able to flatten that curve, you know, buffer it out so that the first one really hit us hard, but not terrible. But then just to see the wave after wave and then the huge one in the fall is what really kind of has hit our team and has meant that it's been a year of managing COVID, the change as you spoke about, the unknown, the uncertainty, and just seeing that death and destruction.
Reflecting on the past year, do you have a low point that sticks out to you?
November was a bad time. You know, the peaks were high. We were dealing with our hospital being 35 to 40% full of COVID patients. Unfortunately, we were losing many patients just in one single shift. And it was dark days of winter. The numbers did not seem to be coming down. We were still on that rise of the peak with no end in sight. And that was a hard time for me personally and for our staff in our communities.
How's your staff doing now? How are you doing?
Thank you. Yeah, we see that shot of hope. You know, we know that the vaccine, we've been doing it since December 17th, and we've been able to vaccinate many members in our community and throughout the state of Minnesota. So we really do see the benefits, especially in our long-term care, you know, our elderly, our 65 and above, and our healthcare workers.
How is the rollout going in your eyes? I mean, not just where you're at, but as you watch what's happening in other parts of our state.
It's been a little uneven, I guess, and I apologize for pause, but just to think about this, it's hard to have something roll out with straight equity across the board. We know that some counties are a little farther ahead than others. We know that some communities are a little farther ahead than others. And we know that really being able to deliver this vaccine, especially to what's called that BIPOC community, the Black, the Indigenous Americans, the patients of color, and then our LGBTQ plus communities, that's been hard. So really to try and make this a vaccine that hits at those risk groups that are both age, disease related, and community related.
Some Minnesotans are hesitant to get their vaccines. I assume, do you have one? And what do you say to the people who are still skeptical?
I understand their questions, their concerns, and many of them early on were, well, I want to make sure it's safe. I don't want to be the first in line. I'll maybe be third or fourth in line. We've taken care of those early adopters or early interested people, and it is safe.
Give us your take on the rolling restrictions we've seen over the past year. Obviously, MDH, the governor, having to make those decisions with changing information, but hindsight is perfect. Do you feel like we did a good job at pulling back the right things at the right times?
I think we did a good job. There were, in the fall, I believe, and I know like you said, hindsight, so Monday morning quarterbacking, we were a little slow.
What could we have done differently? What else would you have changed other than what you saw as a sort of slow response in the fall?
I think the things we could have done differently would have included more of that large, both regional collaboration and then national collaboration. We really missed out on having that as a global plan, a global approach. We were a little slow on getting our communication going with all of the counties and all of the regions, and we were a little slow with everybody understanding the why. You know, communication has been such a key factor in this to help people understand this was not about red or blue. This was not about right or wrong. This was not about government telling people what to do. This was about a health crisis that became a public health crisis. And that is what I think is we had trouble telling that story so that everybody understood it and could get on board and kind of pull together.
It's not a question anyone wants to think about, but I think it's worth asking. Are we ready for the next pandemic?
We will be. We're getting there. I've tried to think of it as if we can do, right now we are investing in repairing the damage that COVID has done to us. That's both health-wise and economic, schools, paychecks, businesses. We are still in the repair. Now the next phase will be more prepare. I might think historically about what the world did, primarily the US, to repair after World War II, the Marshall Plan. So I think if we can invest in that preparation, that planning, that kind of global collaborative effort, because another one will come. Like you said, Erin, it's likely another virus, another pandemic will come. By investing in the preparation, then we will be ready to manage it and have less of an impact.
And we appreciate Dr. Morris's transparency tonight. You'll find the latest on COVID-19 at WCCO.com.